All right, bringing you this now. G7 leaders, of course, had pledged 1 billion vaccines, of course, to poorer countries. But health experts are also saying, on the other hand, that they are raising these concerns about donations, with some even saying at this point that they would prefer it if vaccines were also produced quite locally. So for more on this now, we're joined, of course, by Professor Thuli Oliveira, Director of CRISP, also known as the KwaZulu-Natal Research, Innovation and Sequencing Platform at the University of KwaZulu-Natal. Prof, always a pleasure talking to you. Thank you so much for your time this morning. Now, of course, coming from G7 summit, we understanding that world leaders are pledging that 1 billion, doses of vaccines. Is this the intervention that South Africa sort of needs right now to expedite the procurement of vaccines in the country?
Okay, thank you. Yeah, let's just be first clear. The World Health Organization estimates that the world would need 10 billion vaccine doses to be able to curb especially disease development in the developing world. Of course, the 1 billion, it is good news, yeah. But I think that more than the number, it will be the speed that the vaccines are delivered. For example, not only in South Africa, but as I talk with other health ministers around the African continent, what they highlight is that at the moment, the big bottleneck is the speed of delivery of vaccines. And that's something that we have to clear very quick, because unfortunately, the third wave is starting in South Africa. And so far, our main limiting factors is the speed of vaccines arriving in the country. So it's not just the number, but it's how quick they come and how often they come to the country.
All right. And with that being said, then, we know the United States has also pledged 300,000 Johnson & Johnson vaccines, saying that they will bring them to South Africa with the urgency that is needed right now in the country. Is that more reassuring as well, that, those are sort of, we've seen that commitment from the United States as well?
Yeah, it's good. It's better than not to have access to the vaccines, but potentially the 300,000 vaccines, would be enough for a week of vaccination in South Africa. So what we need, it is all help that we can get on getting vaccines into the country, not only from the Johnson & Johnson, but also the Pfizer, and to make that quite quick. And one thing that's also quite important, and that both our President Ramaphosa, but also myself and another good friend, Professor Salim Abdul Karim, highlight, is that we also need to stop the dependency of availability from the developed world or from the northern partners, and starting to produce vaccines in South Africa.
But Prof, what do you think is delaying that? Because that conversation has been had for over a year now. I think since the pandemic even started around the world, particularly Africa, saying we need to have our own, manufacturing capacity so that we can be able to not only produce locally, but also roll out the vaccine at the speed it needs. Why is there delays at this point?
Okay, the delay is for two main reasons. The first, countries like United States and the UK, which seem to want to help now, they keep all the vaccines in their own country until they vaccinated even teenagers. And in the last few weeks, we see all these cute pictures. What's very nice about teenagers being vaccinated so they can go back to sleepovers. And so far the vaccines were not available. And now that they vaccinate most of their own population, they now want to give the vaccines or make available to the developing world. That's the first thing. The second main important case, it is that at the moment, both the South African President Ramaphosa, the Indian Prime Minister, but also over 100 countries, they are trying to negotiate a temporary waiver of trade-related intellectual property rights. It sounds a mouthful, but it's an acronym called TRIPS. And what that would allow, if you have intellectual property rights being decreased, it means that we could have access to the intellectual property, but also the know-how to produce vaccine in the developing country. And until now, that has not been formalized. I believe that in the next few weeks, it's going to be discussing the World Trade Organization, but that's what has been keeping the local production, is that we haven't been able to get access to the intellectual property and neither the know-how transfer. And let's hope that change in the next few weeks.
Absolutely. I need to bring it back as well here, Prof, if you may allow me, looking at obviously that decision by the South African Health Products Regulatory Authority's decision not to, sort of embark on that rollout of the 2 million Johnson & Johnson vaccines, which were held in Gqeberha in the Eastern Cape, understandably because they've detected contamination there. What are your thoughts on this, and also the setback that we will definitely experience from these developments?
Okay, so just to make clear, the contamination didn't happen in the Eastern Cape vaccine manufacturer, but was in a component that was shipped from a production line in the United States. So that's why SAPRA has decided to halt that. And I think that that's quite important because not only we have to roll out vaccines, but we have to roll out vaccines that are efficient and safe. And that's very important to have regulatory processes that make sure that vaccines that are rolled out, they are really efficient and safe. And that's why they are trying to solve that problem. The problem, again, it came from a plant of the US, but I believe that they just received a new batch of reagents that has not been contaminated. So the vaccine that's being produced here can be at highest quality in the world.
All right, we'll leave it there. Professor Thulia de Oliveira, thank you so much for your time. Always a pleasure talking to you there, coming from CRISP, which is the KwaZulu-Natal Research, Innovation and Sequencing Platform at the University of KwaZulu-Natal.